study, African American men below poverty line at highest risk for mortality. African American men who lived below the poverty line had the lowest overall survival of any group, according to new research that looks at the effects of sex, race and socioeconomic status. The study, which sampled both white and black men and women, found that African American men below poverty levels had almost a 2.7 times higher risk of mortality than African American men above poverty levels. The research was published Monday in JAMA the Internal Medicine. "What's surprising is the magnitude of the difference," said co-author Alan Zonderman, the researcher at the National Institute on Aging. The study also found that white men above the poverty line had approximately the same risk as those below, whereas white and African American women below poverty levels had a higher risk than those above. The risk was similar between races for women, though. The study is only a look after 5 years of a larger study called the Healthy Aging in Neighborhoods of Diversity Across the Lifespan (HANDL) study. By examining the intersection of sex, race and socioeconomic status, HANDL is able to separate each effect on mortality. Many studies that have been done in the past have looked at poor blacks and rich white, and they have sort of ignored the other combinations, Zonderman said. "We can make comparisons, can't look at race, socioeconomic status, and how those two things interact." Researchers define poverty levels as above or below 125% of the U.S. federal poverty guidelines. In 2016, the federal poverty line is $24,300 for a family of 4. Even under these less stringent parameters, the effects of economic status are still seen on mortality. "We're already seeing virulent effects of poverty on one specific group in our study," said co-author Michelle Evans, also a researcher at the National Institute on Aging. "Perhaps we really need to think about that definition of poverty." The authors see the marginalization of African American men in U.S. society as a main driver behind the results. Zonderman said that African American men are often excluded from many mainstream benefits such as health care that could decrease their risk of mortality. The lack of access to medical care, especially to specialists, and an inability to receive health care, even under the Affordable Care Act, both contribute to this marginalization, Zonderman said. That leaves African Americans, particularly African American men, on the margins of the healthcare system, he said. Follow Miller on Twitter at MillerFilmry.